Assalamualaikum and hello everyone. Welcome to our video presentation. Today, we'll be talking about the difference between two anti-thyroid medication, Carbimazole versus Propylthiouracil or PTU. Carbimazole and Propylthiouracil, both drugs are used to treat hyperthyroidism and belong to thiamide class. For Carbimazole, the common brand name is Neomercazole or Thyrocap. However, PTU, the common brand name is just PTU, as it often marketed using its generic name. Brand names are important to recognize, especially in practice, because patients may not always know the generic names. Both Carbimazole and PTU are not controlled drugs and available in oral tablet forms. Carbimazole have dosage strength 5 and 10 mg, while PTU available in 50 and 100 mg.
Next, the mechanism of action. Carbimazole is a prodrug, which means it gets changed into the form called methimazole after absorption rapidly in the gastrointestinal tract, specifically in the liver and blood plasma. Methimazole works by blocking an enzyme called thyroid peroxidase or TPO. This enzyme is responsible for making thyroid hormones. The function of TPO is that TPO helps add iodine to tyrosine molecules inside a large protein called thyroglobulin. This process is called iodination. Another function is TPO also helps combine two iodinated tyrosine to form triiodothyronine T3 and thyroxine T4. As a result, it reduces thyroid hormone levels and symptoms of hyperthyroidism improve slowly over time.
Propylthiouracil or PTU also inhibits thyroid peroxidase, just like Carbimazole. So it stops the same two-step, which is iodination and coupling of tyrosine residues on thyroglobulin, reducing T3 and T4 production. But PTU does something extra that Carbimazole doesn't do. It inhibits an enzyme called 5-deiodinase, which is responsible for converting T4 into T3 in tissues like the liver and kidney. Why is this important? Because T3 is much more active than T4. So by stopping this conversion, PTU reduces the overall thyroid hormone activity in the body, not just production. This extra mechanism makes PTU especially helpful during a thyroid storm, a life-threatening condition with dangerously high T3 levels. Now for the indication, Carbimazole and PTU both used to treat hyperthyroidism. They are indicated in conditions like toxic multinodular goiter, which develops slowly and doesn't involve autoimmune antibodies, and grave disease and autoimmune disorder that may cause bulging eyes. Both drugs are also used before thyroid surgery or radioactive iodine therapy to stabilize hormone levels and prevent complications like thyrotoxic crisis. Now for the difference, Carbimazole is preferred in general but should be avoided in early pregnancy. PTU, however, is the drug of choice in the first trimester and in thyroid storm because it acts faster and blocks T4 to T3 conversion. In short, Carbimazole for stable cases, PTU for emergencies or early pregnancies.
Clinical uses of these two drugs. Firstly, for toxic multinodular goiter, Carbimazole reduces thyroid hormone levels before pre-surgery or radioactive iodine therapy. For Propylthiouracil, it is used when Carbimazole is unsuitable to take due to allergy. Next, grave disease. Carbimazole is used as first-line therapy for children and adults, and Propylthiouracil is used as an alternative when Carbimazole is not tolerated well and preferred to be used only in the first trimester of pregnancy.
Next, before a thyroidectomy, Carbimazole is given to help achieve a balanced thyroid state. If a patient cannot tolerate Carbimazole, maybe due to side effects or contraindications, then PTU is used instead. Similarly, before radioactive iodine therapy, Carbimazole is the first choice to stabilize thyroid hormone levels. Again, PTU is only used when Carbimazole isn't suitable. In short, Carbimazole is the preferred drug and PTU is the backup option when Carbimazole cannot be used.
We move to the pharmacokinetics for carbimazole. Firstly, carbimazole rapidly and most completely absorbed from the gastrointestinal tract. It reaches peak blood levels in 1 to 2 hours after taking it orally. Then, after absorption, it is distributed throughout the body with high concentration in the thyroid gland, where it exerts its effect. It also can cross through the placenta and enters breast milk, so this drug is not advised for pregnant or breastfeeding patients. The drug has a volume of distribution of about 0.5 liter per kg, and it is bound moderately to plasma protein. In the liver, carbimazole is quickly metabolized to methimazole and then undergoes enterohepatic recirculation, which allows it to remain in the body longer and continue its action. Finally, excretion is primarily through the urine, with about 90% eliminated this way, either as the unchanged drug or its metabolites. Around 10% only is excreted via feces. The elimination half-life of carbimazole is approximately 5.3 to 5.4 hours.
Next, pharmacokinetics of propylthiouracil or PTO. PTO is taken orally and get absorbed quickly from the gut. Its availability in the body varies between 50 to 80%, and food might slightly delay its peak levels, but this isn't usually a problem. In the blood, about 80 to 90% binds to plasma proteins, so only a small amount is free to act. PTU can cross the placenta and breast milk, but the levels are low. It's mainly broken down in the liver through glucuronidation and then removed from the body by the kidneys as inactive forms. In mild kidney problem, no dose change is needed. One important point, there is a risk of liver toxicity, especially in kids and with long use, so liver function must be watched closely. And that is PTU's pharmacokinetics in brief.
Now, let's move on to a very important part of our presentation, counselling point. As future pharmacists, it's crucial that we know how to properly educate patients when dispensing anti-thyroid medication like PTU and carbimazole. Carbimazole is usually taken once daily, preferably at the same time every day, and can be taken with or without food. PTU is taken more frequently, usually 2 to 3 times daily, and should be taken with food to reduce stomach upset. Both drugs are used in long term. Carbimazole is used for 6 to 18 months, while PTU is used for around 1 to 2 years, depending on patient response and thyroid hormone level. Patients who take carbimazole should be warned about the side effects like nausea or serious effects like granulocytosis, especially if they develop fever or sore throat. Meanwhile, if they take PTU, they should take note if there's symptoms like bleeding or hearing impairment. Carbimazole is contraindicated in pregnancy, especially during the first trimester, and patients with history of acute pancreatitis, while PTU is preferred in early pregnancy. PTU, however, contraindicated with patients who has risk of severe allergic reaction towards PTU. Both drugs can interact with anticoagulant such as warfarin. It can reduce the anticoagulant effects. PTU and carbimazole should be stored below 30 degrees Celsius in a dry place away from sunlight. Carbimazole comes in blister packs, while PTU is often packed in amber bottles or blister strips. Both of these then will pack in cardboard box containing leaflets as their secondary packaging. In summary, PTU and carbimazole are anti-thyroid medication used to treat hyperthyroidism, including grave disease and toxic multinodular goiter. PTU is more effective in treating thyroid storm because it decreases the conversion of T4 to T3, whereas both medications prevent the production of thyroid hormone. The reason carbimazole is taken once daily and generally preferred is that it has fewer serious effects, as well as being easier to take. However, PTU is also recommended to be taken during first trimester of pregnancy due to a lower risk of birth defects, but it has a higher risk of liver damage. Carbimazole is the better choice for most patients, especially children and adults. PTU should only be used when it is clearly needed, such as in pregnancy or thyroid emergencies. Patients should be advised on how to take the medicine correctly, what the possible side effects, and are the importance of regular checkups. Overall, carbimazole is used in first-line treatment, while PTU is reserved for special cases.